Medschool rotations are a critical part of our training where we get to finally apply the theoretical knowledge to real-life patients. However, rotations can be incredibly challenging and a lot of students tend to struggle to stay on top of their game. Hi there, Gloria here. For those of us that are new to my channel, I am NGM, Njoko Gloria Martins, and I'm a medical doctor living in Nigeria. Today we're going to be talking about how to navigate clinical rotations. If you're like me, well, clinical rotations were very stressful. It's usually very stressful for a lot of people. M1, S1, M4, S4, Pediatrics, O&G, other short postings as well. They can be really very difficult for us to navigate, and I'm going to be sharing some tips or some hacks that is going to help you navigate clinical rotations like a champ. First thing you need to do is to prepare yourself for the posting. For instance, if you're to go into pediatrics posting, you have to prepare yourself for pediatrics. The way you collect patients in pediatrics, the way you collect patients in O&G and internal medicine, they're all very different. So you need to acquaint yourself with the differences involved or with the peculiarities involved in clerking a pediatrics patient. You get there is birth history, nutritional history, developmental milestones, and some other nitty-gritties, informants, and all of that are necessary in pediatrics clerking. So you need to get a note. Now, this one is also very important. Some people, they just use a particular note for all of their postings. So in order for you to prepare for the posting, get a notebook for that particular rotation. You get a notebook, you write down the peculiarities of that particular rotation, of that particular unit. Notebook too is going to help serve like a jotter for you in the course of all of your postings, in the course of your posting in that particular rotation. Do you get? For instance, you have a pediatrics rotation book, you have an O&G rotation book. It may not be a very big book, maybe a jotter or something like that. Next thing you need to do is to acquaint yourself with the common cases you see in that particular unit. Pediatrics, you need to acquaint yourself with diarrhea and vomiting, with some common diseases, and acquaint yourself with the questions you need to ask when you're clerking those cases. Now, there are peculiarities in clerking a pediatrics case. There are also peculiarities in clerking different cases. Like when you get to the history of presenting complaints, you have different cases or different questions, to ask in that case. Another thing you need to acquaint yourself with is your learning strategy. Now, I also made a video too about some game-changing study strategies, study techniques, and trust me, they are also going to be very useful to you. And in that video I mentioned discussion groups. Now, if you have discussion groups, they would also be a lifesaver to you. They would help you to master those things you saw in your rotations. They will help you to discuss about them and help you to know them even better. Some individuals prefer to stay with consultants. They prefer to always stay with consultants to teach them. Like if they are coming for a particular posting, they want to go to where a consultant is. Well, it's not really bad. Some other people too, they are just going to meet the consultant just to do ophthalmology. Now you get the point when I mean ophthalmology, just to show that you come around. It's also necessary, but then you need stuff. Now, consultants are usually available, but then they are not that they are usually available. Sometimes you see them and then they just get to what they are doing and then they are gone. The people that are usually around are the residents, senior residents, junior residents, the attendants. You get some even house officers as well. So those are the people you need to meet. Those are the people that are going to put you through on what you are supposed to know. Mind you, the things you're supposed to know in medicine and surgery, they are big. There are plenty. You get? But as a medical student in medical school, you're training to become a house officer. As a house officer, you're training to become a resident. Do you get? So you're first of all training to become a safe medical doctor. So by the time you graduate from a school, you now become a house officer. So that is what you're training to be. And you don't need to start performing surgeries when you're a medical student. So acquaint yourself with the attendants, the residents. Even the house officers too, they'll teach you how to set lines, how to do the basic things. And then when the consultants are around, also attend their ward rounds. When the consultants are available, you go to their clinics. They will definitely teach you to. You ask questions. To most consultants don't like people that just come and stay and not do any work. You collect patients and present those patients. You talk about management of the patient. Those things will help you to open your mind a little more to the theoretical knowledge you were getting when you were in the classroom. Attending calls too is another important thing you need to know. Most students just go to clinics, like the time for rotations is time for posting is like from 10 a.m. to like 2, so they just go from 10 till 2 and then they go home. Well, if you want to be a better doctor, you're going to have to do more. You are going to have to do more. Now there are calls. You don't need to always be at all calls, because maybe you have lecture the next morning, so make yourself available for the call. Maybe stay an hour in that particular, maybe you're doing pediatrics rotation, for instance. Stay and go for call for an hour. Tell yourself, I want to see maybe like a case or 2 cases, and you see the case, see how it's being managed, and then you go home and read about it. Another thing that is going to help you navigate your clinical rotations is empathy. Now, this is not only necessary for doctors, you need it as a medical student, because when you see patients as patients and not just cases, they help you see that, okay, this is the problem this individual is having, this is the problem this human being is having, and this is how this problem was solved, this is how this disease was treated. If you see it as cases, I don't think you're going to get the full, or I don't think you're going to, well, you can get the knowledge and all, but if you need something to stick better, involve yourself in it. Involve yourself in the management of the patient. It will help you to, empathy too, will help you to want to check on the patient, to see how the patient is doing, and by then you're also still getting knowledge. And this particular point, our consultants was always, our HOD particularly, was always hammering on it, was always shouting it all the time. Read folders. As a medical student, you are privileged to read folders. Now, your Hippocratic oath does not only come into play when you become a medical doctor. You don't go reading patients' folders in order to go and discuss it as per gist. You're reading it to get knowledge. You're reading what was done for this patient. You're reading how this patient was managed. Maybe you were not part of the team that managed the patient. If you're doing surgery rotations, you see what the patient came with, and then you see how the case was managed, what surgery was done for the patient, the post-operative care of the patient. Those things are going to help you learn. Like, that is how you learn. If you have questions, you ask questions. You ask your question to maybe the attendant or to the consultant. Another thing too that would help you is staying organized. I don't know how people do it. Like, you don't write down what you're going to study, you don't make a plan for what you're going to study, you just go with the flow. Maybe it works for you though, but for me, I wouldn't say I'm an organization freak. But then I like to plan things. I like to plan how my week is going to look like. I like to plan it, and I like to plan what I'm going to read for that week. I like to review those things in the long run, and it will help you organize yourself. Write out the things. If you need to draw up a timetable, draw up a timetable, post it on your wall. It's not going to scare anybody. So yeah, organize yourself, and then organize the information, the things. For every day you come back from rotation, write down the things that you saw in the hospital. Write down the things you understood that you saw in the hospital, and then write down the things you didn't understand in the hospital, and then read those things you didn't understand and read the ones you understood. The thing is to involve yourself in the management of your patients. If a patient comes to the clinic and it's required that we need to examine this patient, volunteer yourself to examine the patient. If you need to elicit some signs, if your consultant needs to elicit some signs, volunteer yourself to do all of that. It's not going to take anything out of you. Even if you're not perfect at it, that is the way to be perfect at it, by doing stuff. In ward rounds, if you know a particular answer to a question, say them. Those things helps them stick to your memory even better. There's this thing about dealing with maybe shame, or you don't know you're asked a particular question and you don't know it, and then you start feeling bad or start feeling terrible about yourself. Yes, it's part of the training process. You don't know everything. So whatever it is you're told you don't know, or like you got a question wrong, the idea is that you go back home and then you try to make it better. You get? And then sometimes in this our country, some consultants can be very harsh on some individuals. That is the truth. Some consultants, maybe, I don't know, they can be very harsh. I will not tell you to always be going to that. If somebody is threatening your mental space, leave and go to where at least your efforts are recognized. Do you get? I'm not saying that you're not going to learn what it's necessary to learn in that particular unit, but then that is a threat to your mental sanity. Go to where you're appreciated. Go to where your little effort is appreciated. Go to where you're being pushed to want to know more, not to where it's going to literally downgrade you and all of that. No, please. But mind you, find somebody else that will teach you that topic better. That find somebody that is going to share or pass information in a better light. Set clear goals. Set clear goals for yourself. If you want to go to the ward, tell yourself the things you want to learn. If you want to go to the clinic, tell yourself this is what I want to learn. Like, before you leave the clinic any day, before you leave the hospital any day, ask yourself, what have I learned today? Do you get? Don't just while away your time in the hospital going around and around, oh, I'm a medical student now. Find something. If you go to the ward and then the only thing you're being taught is atrosynthesis, carry it and go home and learn it. You get? If only the thing you're being taught in the clinic is a particular topic, carry it, go home and read. At least you got something out of that. If you go on call and maybe there were no cases that particular day, ask the residents to discuss a topic for you, or you discuss a topic with them and you see that a little more knowledge will be added to the little you know. The best tool, or one of the best, I still feel empathy should top the list though, but another tool every medical doctor and student should have is the power of observation. It's the power of observation. That is one of the best way you learn. Aside doing it, another way you can learn is observation. So when you go to the ward, observe what your consultants are doing. I hope they are doing the right thing though. Observe what they are doing. If you're doing surgery rotations, go to the theater and see how those surgeries are done. Incisions are being made, what kind of incisions are made, what kind of sutures are being used, what kind of instruments are being used, because I'm sure you're going to be examined on instruments for your surgery examination. If you follow these tips properly, diligently, I'm sure you can get more out of your rotations. I'm sure you can be better prepared for your rotations. I'm sure you're not going to come back being so frustrated. Fine, the stress and all of that is there, but at least you'll be better prepared for your clinical rotations. And what more good is there? Yeah. So I need you to share other tips. If you have other tips too that was very much helpful to you in your clinical rotations, please do share it in the comment section so somebody else can learn from it as well. And if this video was very much helpful or you enjoyed it, give this video a thumbs up. I'll catch you guys in the next one. Peace.